Hi, my name is Virginia Hickey, and today I'm going to be talking about the effects on the female body when it comes to birth control. So I'm going to share my screen for the presentation. So first I'm going to define birth control. So birth control can be defined as a substance or like a pill that can prevent pregnancy by stopping the ovulation process of the female body, but this does not include condoms. So some of the types of birth control are medication or pills, condoms, implants, rings, IUDs, or some procedures. So there's a bright side when it comes to birth control. So there's safe ways of preventing pregnancy, and condoms prevent STIs. So according to the article Condom Negotiation Strategy Use and Effectiveness Among College Students, men use condoms less than women reportedly, and race and ethnicity play a role in condom use. Um, Birth control also can help with acne control and prevention, and regulation of extreme period symptoms, which includes heavy periods, cramps, which a lot of women experience. But there also is a dark side when it comes to this. So Healthline lists some hormonal effects of birth control, which are mood changes, migraines, weight fluctuations, no egg release, which according to Planned Parenthood, birth control prevents the release of eggs during ovulation, so you're not releasing eggs that can be fertilized for pregnancy. Also, there's appetite changes, vaginal irritation, blood clotting, and according to the article, one blood clot is one too many. Doctors do not state adequately the risk factors to patients before prescribing birth control, so this is also a risk to these patients. There's also sexual changes when it comes to taking birth control. So birth control can have a strong effect on sex drive. It can increase or decrease sex drive. And according to the influence of hormonal contraceptives on mood and sexual interest among adolescents, it was stated that we found no associations between hormonal contraceptive use and sexual interest. It is possible that hormonal effects were less influenced on sexual interest than behavioral factors such as relationship quality. So this one stated that there really was no relationship, but in the article, the impact of sexual satisfaction, functioning, and perceived contraceptive side effects on sex life on IUD and implant continuation at 1 year. Women who perceived negative sexual effects on their methods were significantly more likely to discontinue using their IUD or implant at 1 year compared to women perceiving no sexual change or positive sexual changes. So there was a relationship in this study. And also mental health is a big thing that's talked about when it comes to taking birth control. Mental health disorders are linked to contraceptive use, and there's also a stigma present around that topic. So mental health diagnosis and early removal of long-acting reversible contraception. In this article, there was a trend in adjusted analysis indicating twice the odds of early removal for women with mental health diagnoses versus no diagnosis. So if they were diagnosed with a mental health disorder or have anxiety or depression, they're most likely to remove the birth control out of their regimen. So here is continuing on with the depression aspect with the hormonal birth control. So depression is a small risk, but it can be present in those taking hormonal birth control. And according to Harvard Health Publishing, can hormonal birth control trigger depression? It states that there's higher risk with progesterone-only birth control, higher risk for teens ages 15 to 19, and higher risk with IUD, patch, and ring types of birth control. So I hope y'all enjoyed my presentation, and thank you so much.